heal you. So we have to talk about the medical model of disease. Because what do we do in today's society? By the way, let's take a step back. 2 Harvard scientists studied 40 nations in the world, and they compared levels of health based on everything that they do, their infant mortality rate, how quickly we die, all of those things. Where do you think the United States fell out of 40 countries? Any guesses? From anybody who's not heard me talk before.
Like number 30?
Any other guesses? 37th. That's at the bottom. 37th out of 40. This was released November 3rd, 2009, but US is 30th in global infant mortality. That means that it's safer for us to deliver a child in Jamaica or Puerto Rico than it is here.
Really?
Yeah, they were higher. So what we do here in the United States is we medicate, right? We just talked about that. When you're sick, you go to the doctor and they're gonna give you a what?
I feel.
Yeah, something to feel better. Does that fix it? No. We have more medical doctors here than anywhere else in the world. And why do you suppose that is? Any guesses? Let's say I went and practiced in, I don't know, some island somewhere, or Russia, where people don't rush over to medicate for a scratchy fingernail. They're not going to get paid as much, so everybody comes over here. So we arguably have the best medical doctors in the entire world. We consume over 60% of the world's medications. The rest of the world splits the other 40%. So if we know that we're taking more medicine, we have the best doctors in the whole world, we have the finest equipment, technology for testing, exams, mammograms, I mean, you name it, we've got the best equipment. Where should we be on the top or in that list?
Up at the top.
At the very top, but where? We're 37th. So doesn't that alone tell us that the model that we're living in is ineffective? So what happens is we wait, and we wait, and we wait until we're sick and broken of disease before we finally seek out some help. So we don't know the definition of health, do we? Does anybody here have a good definition for health? I picked Stephanie's brain. She's in the wellness industry, and I could bring in doctors, medical doctors, chiropractors. Nobody knows the definition of health. Anybody want to try?
I thought about it a little longer. The word heal in there. I think it is like our body's ability, like, just like you said, the power that made you can fix you.
You got it. That is the definition. It's healing. Your body can only heal when you have 100% of your normal function and healing, right? So if I'm not functioning 100%, say I'm functioning at 60%, I'm going to heal at 60%. Who would rather have 60% versus 100%? Nobody. So if we look at the definition, and it specifically says, the root word of health, of course, is heal, but it says function and healing. Is exercise going to get you health? Anybody?
No health.
It'll contribute to your health, but does it make you healthy? No. If you had heart disease and you exercise, is that going to make you healthier?
Yeah, I'd say so. No?
It'll prolong the inevitable.
Okay.
I'll share a story. There's a gentleman here in Des Moines. His name is Chad. I'm not going to use his last name, but he's a triathlete. Ripped up. I mean, the guy can do an Ironman, has done Ironmans. Physically, he looks like the picture of health. 39 years old, had a heart attack a couple of weeks ago. Was he healthy?
No.
No. How about the day before he had that heart attack? Was he healthy?
No.
Okay. So, eating well. Does eating well give you health? Part of what Imogene saw on Dr. Oz was that if you eat well, you can reverse heart disease. We'll talk about the cause of heart disease here in a few minutes, but I'll preface with it won't. It'll prolong or move back the inevitable, but it doesn't give you health. Will getting enough sleep give you health? Will sleep heal that cut? No. How about managing stress? If you decrease the amount of stress that you have, will that give you health? No, again, are all these things good for us? Of course. But they, by themselves, can't give you health. Well, drugs give you health. Let's use an example. Let's say this thing were full of high blood pressure medication, for lack of a better example. If I took this whole thing right now, what's it going to do to me?
Overdose.
Yeah, I'll overdose. And what's that going to do?
Yeah.
It's going to kill me. Is it going to kill me quickly or is it going to kill me slowly?
Slowly.
Pretty darn quick, right? Now let's say I take one of those every day. Is it going to kill me quickly or slowly? Yeah. Because poison, whether it's in large amounts or small amounts, is still poison, right? So drugs can't give you health. So let's talk about the nervous system and your body and how everything comes together. Any idea how long God programmed your brain to live? Any guesses?
No clue.
What's that? One. Smart aleck. 120. You ever heard that? It's in the Bible.
Mm-hmm.
Harvard Science says 120 to 130 years. How about your heart? How long is that heart programmed to live? And by the way, that brain is programmed to be 120 years old in every one of us. What'd you say?
120.
120? Any other guesses? It seems like a logical guess. It's programmed to be 90 days. How about your lungs?
10 days.
60 days. Your skin, 14. We could keep asking you different organs, but you don't know. So we'll stop. But let's look at the example of the heart. It's Heart Month, right? We'll talk about the heart. If your brain is designed to be 120 years, how can your heart only be designed to live 90 days? How does that make any sense? What happens?
Without the brain, the heart won't work.
But you're still here. Any guesses? What happens to cells every day?
They
Regenerate.
Yeah, they regenerate. So our whole body is nothing but cells. So the cells are constantly dying and the cells are